everybody. Welcome back to I Care for Your Brain with board-certified neuropsychologist Dr. Karen Sullivan. Tonight we are doing another bite-sized brain health where I try to give you the very best I can in under 10 minutes. Let's see if I can do it. The topic tonight is what to do if you are worried about your parents. Many adult children are living alongside parents who are aging. Once we are over the age of 65, our risk for dementia doubles every 5 years. Now, dementia is not inevitable as we get older, and I want you to understand that. And I do want you to be empowered with what actually happens to folks and their brain function as they get older. We see three distinct possibilities. We have normal cognitive aging, we have mild cognitive impairment, and we have all of the dementias. Mild cognitive impairment is just a little more difficulty in everyday life and with cognition than we would expect for age. But the big difference between these three syndromes is normal function and abnormal function in what we call instrumental activities of daily living. So with dementia, we have a significant decline in more than two cognitive areas, typically memory and something else, maybe word finding, maybe attention. But we see that the cognitive symptoms are significant enough that there is a consistent negative impact on driving, remembering to get to doctor's appointments, remembering medications, and most sensitive of all, complex financial management. Under the umbrella term of dementia, we have multiple diseases that cause dementia. Dementias typically start in one of two ways, either acute all of a sudden or gradual, almost imperceptible, where it's really hard to put your finger on, is this a problem or not? So I want to tell you exactly what it is you are to look for. So Alzheimer's disease is one of the most typical dementias. The most common dementia is actually mixed dementia. So what we see here is on autopsy, if we were to look at the person's brain, we actually see more than one subtype. So we usually have one type of dementia that's kind of leading the way, and that does tend to be Alzheimer's. So let's cover that one today. Alzheimer's disease starts, like I said before, kind of imperceptibly in most people, and we see it in repeating questions, repeating stories. And one of the things you can look for is the intonation with which someone speaks when they are repeating. So there is a way we phrase our sentences when we think we've maybe said it before versus when we're not sure whether we have awareness whether or not we've said it at all. So there is a way of speaking when it feels brand new, and there's a way of speaking when you think, maybe did I run this by you before? So with Alzheimer's, it would be that intonation of brand new. It's as if I've never asked this question before. We also see word finding difficulties early on. So this can be calling objects the wrong name, kind of having a hard time focusing on the word that you want to find, kind of dancing around it, the what do you call it, the whoozy-wassy. When we see acute or rapid changes in cognition, this more so points to a vascular issue related to blood flow, so strokes, mini strokes, or we can also see things like urinary tract infections, medication effects. The quicker a cognitive problem starts, the more quickly I want you to get to medical attention. So the key to understanding your parents' brain health would be to observe them over a period of time. We don't want you to overreact to one instance because the truth is we all mess up. Even people in their 20s sometimes forget where they're going or get distracted and go the wrong direction. What we really want to look for in our older folks is a pattern of behavior that concerns us. So the very first thing is you want to just be a good observer. And what you're trying to do is compare your parents' normal baseline to how they are in their older age. And remember, when we're going to get to normal cognitive aging in a minute, plenty of things about our brains don't change at all as we get older. And what we really don't want to do is baby older adults. We don't want to take a paternalistic approach to caring about them. So what we want to do is make sure it's based in fact and reality and data. So I want you to take into account their physical and sensory limitations. So you have to make sure what you're not actually worried about or noticing is trouble with hearing. So plenty of folks I see as a neuropsychologist, they actually have a hearing problem. They can't hear what's being said, so they never make a new memory of it. We also see people who maybe have a little bit of difficulty getting around because of vision issues. So you have to take into account age-related change, okay? The other thing are physical limitations. So perhaps is someone not getting enough stimulation in their brain every day because they have a hard time ambulating and they just don't have conversations with people throughout the day. So when you go to talk with them, perhaps they seem a little bit dull, not quite as engaged, but it might be due to a lack of connection socially. So in Alzheimer's disease, one of the most important areas I want you to focus on is new learning. So if you bring a gadget into the home, it would be normal for an older person over the age of about 65 to maybe need you to go through the directions more than once. But what would not be normal is if they just can't get the hang of it, no matter how many notes you leave, no matter how many times you go through it. If you can write it down, if they can write down directions and they can know where to go find the directions and compensate, it's really nothing to be worried about. I want you to think about bringing up your concerns in a calm moment. Remind them that they raised you to do the right thing, even when it was the hard thing. I want you to pick a time and a place that is non-threatening and familiar, and understand that the word dementia means a whole lot to an older person, maybe something different than you can appreciate what it means as a younger person. So dementia is a very anxiety-provoking concept for most older adults. And I want you to make sure you are not being judgmental, not jumping to conclusions, and using reassuring languages. I would start off by asking if they themselves have noticed any changes in their memory or if they're worried at all about their brain health. I would then mention very specific examples that I was concerned about. I would explain what a neuropsychologist is, and maybe you've been watching one on YouTube, and that they have helped you understand that it's really important to get a memory evaluation because so many positive things can come from it. Many people aren't aware that we do have medicines for some types of dementia that can slow down the symptoms more so than if we didn't take the medicine. And of course, the earlier the better, because we want to slow it down in the more mild times. Oftentimes, we find treatable aspects of a memory problem that can reduce the severity or the intensity. And we also sometimes find medical issues that are totally related to a memory problem that are fully reversible. So we have pseudo dementia, which can happen because of depression. Many times we are finding problems with medications. There can be sleep issues. And in fact, anxiety about dementia can also be such a distraction and create such a barrier towards attention that sometimes the people who come to see me who are convinced they have dementia actually have a dementia-related anxiety problem. So what I really want you to do is emphasize that knowledge is power. I want you to ask them to please go to their primary care physician as a start. Follow that recommendation over time. And if they aren't able to do it, the next step would be to ask if you yourself could contact the primary care provider or go to an appointment yourself. Now, depending on how defensive or open your parent is, you might be able to go in and reiterate the same things I recommended to your parent, to the provider. But if your parent is resistant, or if they don't seem to have any insight whatsoever into the fact that they are having changes, then write a letter, make a call, try to see if you can get someone's assistant on the phone to just let them know that you are concerned and you would like them referred to a specialist. The very best specialist for cognitive concerns is a board-certified neuropsychologist, and you can find one in your area by just Googling how to find a board-certified neuropsychologist. You'll then go onto a website that will allow you to put in the zip code, and you can find someone as close to your house as possible. A board-certified neuropsychologist allows you to have the confidence that we are the most competent care provider and care partner that you will need to help you help your parents. Thank you guys so much. I don't know if I did it in less than 10 minutes, but I sure tried. Please like, share, and subscribe, and come back next time for more science-based brain health to allow you to be the very best advocate you can for you and your parents. Take care. Bye.